Turn my mic on. Good afternoon. I'm Judy Hopkins, Chair of the Human Services Committee, and I call this meeting to order. First order of business today is roll call.
Mrs. Hopkins,
Here.
Mrs. Burdick, Mr. Barnes,
I can talk to you after this.
Here.
Mr. Decker,
Here.
Mr. Havey,
Here.
Mrs. Root,
Here.
Mr. Stockin, Mr. Crandall.
Here.
7 members present.
Thank you very much, Megan. Megan is always a great help. The next order of business is to approve the minutes of August 4th, 2021. Motion by Mr. Decker, second by Mrs. Root. Any changes or corrections to that? If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Great. Okay, our first report for this month is Tyler Shaw, our Public Health Director, and he joins us today. Thank you for coming, Tyler.
Thank you. All right. Before I start my monthly report, I'd just like to give a couple of COVID updates. Even since writing these updates last week, we've moved from substantial community transmission risk to high transmission risk, and are consistently surrounded by numerous counties also in that high community transmission risk category as well. Vaccine data, 17,450 individuals with completed vaccine series, which turns out over the total population, that's birth to over 90 years old, 37.5% vaccinated rate. So out of the eligible population, 40.2% with at least one dose, 47.7% of the 18 plus population with at least one dose. Just to give you some age categories on percentages, 55 to 64 age category, 51.8% vaccinated. That's completed series. 65 to 74 age group, 67.5%. And then I took the 75 plus category, 68.2% is completed with their vaccinations. And then just to break it down a little further, my last little stat here is gender, male to female, 41.7% of females have completed their vaccine series compared to 32.9% of males. So some good statistics out there.
Thank you. I have a couple of questions about
Sure.
that before you start your regular report, and probably there might be some other questions about that too. Are you finding that there has been an increase in vaccination rates also along with the increase in the cases that we're finding? Is this helping people to realize that the vaccination is important?
Everyone has their reasons for why they want to be vaccinated, whether it's they don't want to be quarantined, whether they have high-risk individuals in their household. We're seeing a pretty steady stream at this point of the vaccine. It hasn't drastically increased or decreased. It's pretty steady stream.
Thank you. My other question is, in the cases that we have now had, is there a breakdown of a particular age group that is being affected now more than others?
Not in particular. Typically, it's the high-risk individuals who are still seeing hospitalized. The vaccine rates, there are some MMWRs published out there through the CDC on various, if you're fully vaccinated, what your risk for hospitalization is, how much it decreases. There's lots of stats out there on that. We are seeing several breakthrough cases on fully vaccinated individuals. We've seen about 31 so far. To date, that's as of today, primarily through Moderna. We've had 14 of those cases. J&J, we've seen 11, and Pfizer, we've seen 6. Now, some of that is accounting for, if you remember back in January, when the vaccines first rolled out, we could only get Moderna vaccine. So that plays into the numbers a little bit on why we're seeing more Moderna breakthroughs, because we were vaccinating more people with Moderna. So.
And are we seeing any kind of a difference in the effect of the disease on people that have been vaccinated? I know one of the hopeful things about the vaccinations is that if you should get it, despite being vaccinated, it's more possible that you will not get such a bad effect and end up in the hospital and in ICU.
Sure, we're seeing those effects. So if you're fully vaccinated, you're less likely to be hospitalized. You're less likely to come down with a serious illness in order to need hospitalization.
Oh, you said it better than I could.
No, that was fine. And then, so there is another MMWR out there about vaccine effectiveness. That's been a huge question out there lately, especially in this study they did from February 1st to April 30th of this past year. They followed individuals 65 and older, and they found that Pfizer and Moderna were found to be greater than or equal to 91% effective still, and at preventing hospitalizations. And then the J&J was greater than or equal to 84% at preventing hospitalizations as well.
Okay.
So those are good numbers that we're continuing to study at the CDC level. So
Thank you. Thank you. Anybody else have COVID questions for Tyler? Mr. Heavey?
Hi, Tyler.
good afternoon.
Tell me what we need to know about booster shots.
Good question. So trying to keep the terminology straight here. So there's an additional or a third dose, which is for the immunocompromised individuals. That is going on. We have clinics starting as early as next week for those individuals that meet very specific CDC criteria. The booster dose is not approved yet. Likely at the end of September, we'll be in full swing of the booster dose. So there's the additional dose for immunocompromised, and then there's the booster dose for everyone else in the general population. You're welcome.
And Tyler, would you just quickly clarify the definition of immunocompromised? Because I think it's confusing for some people as to what that really means.
I don't have it off the top of my head, but if you visit the CDC's website, and we have a press announcement out there as well that has very specific criteria. It's usually active cancer treatments, if you had convalescent plasma therapies, and there's a couple other items on there as well.
Thank you. And I guess what I was driving at is that is a different category than people who were likely to have serious effects from COVID back in the height of the crisis. So thank you.
Yes, not the comorbidities that were first.
Right,
when first
comorbid.
Yep.
Thank you. Mr. Healey?
Thank you. Tyler, how about the regular flu clinics? Do you know when you're going to be starting those up?
Sure do. We are traveling again to each of the 5 legislative districts. I have my schedule right here. It did go out in a press announcement as well, so that schedule should be out there and on our website. We have regular flu immunization clinics Tuesday, September 28th at the Houghton Fire Hall. We have one Monday, October 4th at the Legion and Friendship. October 5th, we're having an Office for the Aging clinic. Tuesday, October 12th, we'll be at the Bolivar Fire Hall. Monday, October 18th, we'll be at the Andover Fire Hall. And Wednesday, October 20th, we'll be at the Almond Community Center. And we'll have some other flu clinics here at the county building as well.
Thank you. Yes, Mr. Decker?
Tyler, 2 questions. First, back on the vaccine, are you able to get now all the vaccines that you can administer? Before you were having difficulty, weren't getting the vaccines. Are you able to get enough now to vaccinate everybody that wants to be vaccinated?
We are able to order Pfizer and Moderna pretty regularly. J&J had some sort of manufacturing hitch where we've been borrowing from other providers across the state in order to get J&J. They have not been manufacturing and shipping it to New York State. That's likely to pick up again mid-September. So right now we've been borrowing from, we'll say Erie County as an example. As a provider, we'll just go wherever we need to pick those vaccines up. Yep.
Okay. And my other question on the common flu, can we get those common flu vaccines at the pharmacy like we did last
Still
year?
can. Yep, absolutely. Yep. And we're putting that list out too when they'll be available through the pharmacies. Yep.
Thank you.
You're welcome.
Okay. Mr. Crandall has a question.
Yeah, comment, and our public health director, I'm not sure if he was going to bring this up. I think he's just jealous because he couldn't attend yesterday. But myself and his deputy director, Jamie Darcy, and I went up to meet with the governor on a very short noticed meeting. There was a press conference yesterday at UB Medical, and it had to do with COVID and the governor's position on how she is going to handle this a little different than her predecessor. In her message yesterday was to enable local municipalities or local county health departments to have a little bit more say and control on what goes on here. There's been funding set aside for that. She also talked about the schools masking and vaccinations as far as their personnel is concerned as well. But I did want to mention that myself and the deputy director were able to go, and it was a very small group. There were only 30 people I counted that were, had special seating, assigned seating such as us. The rest were press and agencies and others that were there. But the governor wanted to have this announcement made, one in Western New York and two utilizing the Western New York control room folks, which she was started out on a daily call a little better than a year ago, and then it went to weekly and so forth. I really felt bad that our county administrator, Carissa Knapp, was not able to attend because she was the one that really was the front line on those telephone calls along with Tyler. But without them being there, I was certainly glad to go, and I know that Jamie was as well. So, and each of the counties were recognized as being there, and I just thought it was a good meeting and one that we did not want to miss for sure. So
It's good to be
Thank you.
included in that. Thank you for going.
Thanks.
Thank you. Okay, we'll let you do the rest of your report.
Okay.
Thank you, Tyler.
Nothing too crazy on the monthly report side. We did have some of our last minute school vaccines. We do have those coming up on September 2nd and 3rd in case some students need some of their immunizations before they return to school. We are starting to go back out to some events for our health education. So we did attend in June 2021 3 lead poisoning prevention events. So we are picking up in those activities. And pending any questions on the monthly report.
Just looking still at the lead on there, July 2020 and July 2021 have a significant difference in the number of cases on being more in 2021, and yet the tests reviewed were significantly more in 2020. Can you explain why that was?
A lot of that on the test review depends on birth dates and the birth rate in the county. So we're reviewing those 0 to 2-year-old test results, and we're reaching out to the families and letting them know whether their child needs to be tested through their pediatrician or not.
Okay.
So it will fluctuate.
Still significantly more cases, though, as I expected. Thank you.
Madam
Okay.
Chairman?
Yes, Mr. Decker.
Tyler, on the WIC program, I noticed this when I was reviewing these at home. The first sentence there, in response to the Families First Corona Virus Response Act, the WIC program has waived the physical presence, height, weight, and blood work requirements until November 16th. Why is that significant? You got it in red.
Because they don't have to physically come into the office at this point. So the state WIC office keeps, and the regional office keeps pushing that date out as they're kind of filling out the COVID situation. So right now they can do most of those things either over the phone or by getting some medical charts from their pediatrician.
Okay, thank you.
Any other questions on the report? Okay, I think we have a couple of items of business here for you. More than a couple, but go ahead.
All right. First on the agenda is a request to ratify my signature on facility use agreements for our off-site flu immunization clinics with Andover, Houghton, Bolivar, the Town of Almond, and the Friendship American Legion.
Okay.
And these have been reviewed by the interim county attorney as well.
Thank you. We'll take a motion on that. Mr. Healey, second. Mrs. Root, any discussion about that? If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Next.
All right, next is I'm requesting for an approval to extend my 4 temporary part-time office aide positions. With COVID, this is still the way it is at this point. The school's starting to open back up. We're likely to see a little uptick in COVID cases, and the federal government has extended our contract till March 31st, 2023 as well. So I'm looking to extend my temporary part-time office aides until that date.
Thank you. Motion on that, Mr. Stockin, second, Mr. Decker. Any questions about that? This is not great news, unfortunately. It means that we still need them, but they certainly have made a difference in the response for our county to the COVID. So if there are no other questions, we'll vote on that. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. And next we have a create and fill.
All right, I'm requesting to create and fill a temporary health coordinator position in my office. This is funded through our federal grants, both for salary and fringe as well. And this position is primarily going to be dealing with all of our school districts for COVID-19 school reopening testing, helping them with supplies, technical assistance with testing, and just general coordination effort as well.
Okay, this person should be quite busy, and hopefully we can get them on staff soon, considering school is opening today.
Yeah.
Motion by Mr. Havey, second by Mr. Stockin. Any discussion on this? We should mention that this was previously approved in the Personnel Committee just a few minutes ago. Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. And next we have another create and fill.
Yes, I have a bunch of positions. So this is also 100% federal funded salary and wages for our school reopening funds. And this will be clerical support for our grant deliverables and any other questions that the schools may have. They could answer those. So I'm looking to create and fill a temporary typist as well.
Okay, we'll need a motion on that. Mr. Decker, second by Mrs. Root. Any questions? Okay. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Moving along.
Okay, in a separate pot of federal money, we did get an additional funds, which is also funding our office aide positions. We got additional money through the feds, and I'd like to create and fill 2 temporary registered nurses positions. These positions would be very helpful for vaccination efforts, our testing efforts across the county, and also as a supplement to the schools. If they couldn't collect specimens, we also could use these nurses for that as well.
Okay, motion by Mr. Havey, second by Mr. Decker. I noticed that you have both full-time and part-time checked. Is one full-time and one part-time, or is it still not figured out on whether it's going to be full-time or part-time?
Thank you for mentioning that. I failed to mention it. I'd like to have the flexibility to do either. It would be 2 positions. I have the funds to do both full-time, but the likelihood that we'll find a temporary nurse full-time is probably non-existent. I need to fill these positions rather quickly, so.
Yeah, I was going to ask that. It's sometimes difficult to find registered nurses. So, okay. Any other questions on that?
There's,
Yes, Mr. Decker.
how, in light of that, how confident are you you're going to be able to find some registered nurses that are going to take the position?
I know one that we likely have on staff right now that would do part-time. She's actually doing a different position.
Would she have to move from that position or be able to do both?
She could do both. As a registered nurse, she could do both, yeah.
I see. Okay. Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. And I believe the last one we have is for the Director of Patient Services.
Yep, due to a resignation by our current Director of Patient Services, I'm looking to backfill that position once she vacates. She has given a date of September 24th as her final date. So we will be trying to recruit, and that is a bachelor's prepared nurse. So those ones are a little bit tougher to find, but that position is integral to our department. I mean, they're really leading the COVID vaccine effort, the testing effort across the county, and they'll be overseeing the office aides and our newly hired RNs as well.
Okay, thank you. We need a motion on that, Mrs. Root. Second by Mr. Stocking. Questions on that? Other than let's get this filled. I know we need it. All those in favor, please say aye.
Aye.
Any opposed? That motion's passed. Thank you very much. Tyler, is there anything else that you'd like to add today?
No, I think that covers everything, unless there's more
Okay.
questions.
Well, again, we thank you and your department for all the work that you're doing on COVID. We certainly had hoped that we'd be at the end of it by now, but can't let down the guard.
That's right.
Thank you.
Thank you.
Okay. Okay, our next report is going to be from the Office of the Aging. And Anita Madison is not here today, but she has sent a very good representative. If you'd like to introduce yourself to the public.
My name is Kimberly Geffers. I'm the accountant at the Office for the Aging, and I'm here for Anita while she is off, hopefully celebrating her birthday.
Okay. Are there some things you'd like to go over in the monthly report?
Yep, I just wanted to highlight our personal emergency response has increased this month. Last year we were serving 142 people. This month we are serving 170. That is the Help I've Fallen and I Can't Get Up button. And also the increase in our caregiver services through our Alzheimer's Disease Caregiver Support Initiative has increased from 174 units for the same month last year to 203, just over 203 units this month. And as of the 25th of August, we have distributed 671 farmers market coupons to seniors in Allegheny County.
That's great. That's a new program this year.
No, actually,
You had
that
it last
is
year?
the farmers market coupons come from the state. They send them out to us. We implemented this year an increase for an additional coupon for an additional $10 for seniors.
Okay, great. Okay. Yes, Mr. Crandall has a question.
Just on those coupons, are those getting turned in and utilized well?
They are. We have. They've been coming back. The additional ones, you mean, or the ones from the state?
Well, the ones that end up in the farmer's market, where were they?
All of the ones from the state and for the new ones that we got this year for the additional are. They go to the farmers market. The additional ones are being sent back to our office for reimbursement to the farmers markets themselves.
Okay.
The other ones go back to the state for reimbursement to them.
Getting to the farmer's market, utilizing those, that's a good,
I
because
believe.
I think it started out with a little bit of a slow start, if I recall.
Yep, we have done. At this time, I think we've received claim for over 150 of the additional booklets.
Good. Nice. Thank you.
Yep.
Okay. Do you want to mention a little bit about the town listing sessions that you're having?
Yes. Anita is going to be hosting town hall sessions, essentially like a small version of a public hearing. We are trying to schedule 2 in each district. There is an additional one that we are working on getting scheduled. It is for Andover. We're anticipating it will be on the 8th of October from 11 to 1 at the ambulance bay. We are just waiting for confirmation and permission to hold it at that location.
Okay. And there is a press release on this, but this is in place of the senior forums to gather information and input from the seniors in the
Yes,
in the
from the
districts.
community. This press release has not gone out yet because we are waiting for confirmation so we can add that last date to it if we get that confirmed.
Okay, great. Thank you. Good idea to still try to get that input.
Yes.
Yeah, good. Any other questions for Kim? Okay, we'll move ahead then. Kim has some requests from the Office of the Aging as well.
The first one I have is a request for a budget adjustment. Essentially, we just want to increase the budget and the corresponding revenue to exhaust a little more of our state funding in this calendar year because our state funds run on a state fiscal year of April to March.
Okay. Okay, and that is a total of about $70,000, right?
Yes, and that will make it able for us to draw down the full amount of the allocation that's been awarded to us.
Okay, thank you. Motion on that, Mrs. Root, second by Mr. Stockin. Any questions or discussion? All those in favor, please say aye.
Aye.
Second, any opposed? That is motion's passed. Thank you. Okay,
Thank you very much. The second one is essentially the same thing. It's just for a different state grant. This is for our New York Connects expansion and enhancement, and the total for this one is $24,000. And again, this is going to make it easier for us to ensure that we're claiming the full allocation.
okay, thank you. Motion on that, Mr. Decker, second by Mr. Stockin. Any discussion on that? Okay, all those in favor, please say aye.
Aye.
Any opposed? Okay, that motion is passed. Thank you.
The third one is, again, basically the same situation. This one's only for a total of $6,000, and this is just to get us in line to expend and claim the full allocation for the community services for the elderly budget.
Okay. And need a motion on that. Mr. Healey, second by Mr. Decker. Thank you. Any questions on that? Okay, all those in favor, please say aye.
Aye.
Any opposed? Okay, that motion is passed. Okay, go ahead, Kim.
All right, we are requesting permission to enter into an agreement with Dave's Diner in Ceres. And this is under the Go and Dine program that we are piloting that's in its infancy, but we're getting it started where seniors, rather than attending the congregate luncheon sites, will receive a voucher to go out to a local restaurant and try and have a meal there. This is the second location that we are working with at this time.
Okay, need a motion on that, please. Mr. Decker, second by Mr. Healey. Thank you. Any questions on this? You might just mention the other restaurant that you presented before that you have the agreement with. That's okay. I was blanking too, so
It's in Bolivar.
it's in Bolivar, yeah. I think it's here. It's Jacob's Cafe.
Jacob's Cafe.
We have an aficionado up here on the.
Thank you very much for that. I
Thank
did know, I
you.
would have known it 10 minutes ago, but
Right, right. Mr. Crandall, did you have a question?
As I sit in District 5 here, I just find out that I'm compelled to raise my hand and say something or ask questions. But this is backyard trivia that I know Mr. Dibble knows. That's Dave's Diner's famous for the Tiny Tim stop. Tiny Tim stop there. Broke down with his VW back years ago. Ask Bill Dibble if you want to know more about it, or the folks at Dave's Diner.
Was that?
The tulips weren't in bloom.
Mr. Crandall is referencing a well-known but person who has died, who was famous back in the, when was it, Mr. Crandall?
Way before my time. I'm too young for that. You know that.
Okay,
Anyways, Allegheny County trivia. Tiny Tim was at Dave's Diner.
that's great. That's great. Okay,
Tiny Tim from Wellsville to New York City one night.
thank you. Little humor never hurts. Thank you. No, it's great. Thank you. Woke everybody up. Okay. Okay, we'll let you continue then, Kim.
okay. This is, again, just part of the Go and Dine program. The budget is already included in our budget because we anticipated piloting this program.
Okay, thank you. We have a motion on that, I believe. Yes, so we just need a vote now. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. The acceptance of a donation.
Yes, this is the donation that actually we were just discussing. It comes from the Allegheny Senior Foundation on behalf of the United Way. And this funding is being administered to support the additional vouchers that we're giving to seniors to use at the farmers market.
Okay, great. Thank you. Need a motion to accept that? Mr. Hamey, second by Mrs. Root. And we need any discussion on that? Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Okay, next.
This one is my personal favorite today as the accountant. We are requesting a resolution to accept a supplement in one of our state grants, which is the Unmet Needs Fund. They did award us, at this time, a one-time supplement, and this is the $119,300 that we anticipate adding to and using in our 2021 budget. There is no county match for this funding, and it is being administered after when the grant began in 2019 and the state assessed county spending. The counties that were not spending their full allocation received less funding, and those of us who were spending it received more.
Wow, okay. That's a good thing. Motion by Mrs. Root, second by Mr. Stockin. Okay, any discussion on that? Other than to say yay.
That was my thought when I found out.
Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Okay, and last, we have a request to create and fill.
Yes, and actually it is based on receiving that funding. We are requesting permission to create and fill a part-time aging services technician. This position is going to offer insurance counseling. They'll help with in-home assessments for services and Meals on Wheels, and they'll also work with our specialists to schedule the laborers and help us reduce our home care waiting list. We originally planned to have this included in the 2022 budget and hire in January, but with this supplement, we're looking at being able to hire them now,
Okay,
soon, hopefully.
thank you. Thanks for explaining that. Motion by Mr. Stockin, second by Mr. Healey. I'm sorry, Mr. Havey. I'm looking at Mr. Havey. Questions, discussion? Okay, all those in favor, please say aye.
Aye.
Any opposed? Okay, that motion is passed. Thank you. Kim, is there anything else you'd like to share with us today? Oh, Mr. Healey does have a question.
Yes,
I
thank you,
can get the
Madam
name
Chair. Yes, Kim, can I back up just a minute to these farmer market coupons and also the Go and Dine programs?
Yes.
Are these income-based programs, or are they just available to the general public?
The farmers market coupons are income-based. There's a form that has to be filled out and signed that the person acknowledges that their income is under the threshold. I apologize, I do not know what the threshold is. But they do have to certify that they are under that income requirement in order to receive the farmers market coupons.
Okay.
There is no income requirement for the Go and Dine program, just as there isn't one for the congregate luncheon sites. So anyone who is over 60 would be eligible to call and request to be in the program, and they would receive their vouchers. And it's the same way as the Meals on Wheels and the congregate luncheon centers. There is a suggested contribution, which is optional and voluntary.
Okay.
And
Thank you very much.
And we should perhaps add for the listening public that it is for only the restaurants that we have the agreement with, correct?
Yes, at this time, it's a pilot program in the immediate Bolivar series area. We are hoping to expand across the county over the next few years.
Okay, thank you. Okay, I think we're all set then.
All right, thank you very
Good,
much.
thank you for coming. Wish Anita a happy birthday.
Yes, happy birthday if she's watching.
Okay, and our next report is from Edna Kays, our Social Services Commissioner. Edna, thank you for coming.
Good afternoon.
Good afternoon.
So I'm going to be brief today, I hope.
Wow.
Do you have any questions on our report? I do want to give you a little snippet on ERAP, Emergency Rent Assistance Program, as you may have been hearing about in the news lately. In Allegheny County, for rent arrears extending back a year through the COVID time when folks didn't have money to pay rent and the eviction moratorium was in place, we have about 119 applications in Allegheny County. 7 of those applications have been paid for an amount of $35,000. So they're still hoping to speed up those payments to folks, to landlords that are for their tenants.
And the landlord is actually getting the money.
Yes.
'Cause there was a
Landlord gets money.
controversy about the money going to the tenant. The tenants were buying cars or motorcycles or whatever, weren't paying their rent. Is that anything relevant here?
No, the tenant applies, and if the landlord is a part of that application and fills out their amount, that money would go right to the landlord. If the landlord does not do that application piece, that money is held for 18 months in the hopes that the landlord will join in.
Great.
So
Glad you're
no,
on
the
top of
money
it.
would never go to the tenant.
Very, very
Okay.
good.
Thank you, Mr. Graves, for the question. Okay, go ahead, Edna.
So, again, we have 119 applications out. They are completed by the Office of Temporary and Disability Assistance. We do help here in the county if there's a need, but those go directly to OTDA, and they make those determinations on the eligibility and then send out the rent accordingly. But I think 119 is a pretty good number. There's a piece in that, in the ERAP funding that is for prospective rent. So that's rent going forward. So if they've paid that 12 months rent, they will also cover up to 3 months rent going forward. And we have 4 of those at $8,600. And then there's some utilities that we would go back and help pay utilities as well. And that money would go directly to the utility companies. And at this point, there's 30 of those applications. And I don't know how much of the utilities have been paid out. I can't give you that number. But so I think that's good news. And yet I think we are hoping that picks up with the new governor, that we're able to get those payments out a little bit quicker. And that's really kind of what I have to share.
Okay. Okay, any questions about the report? Okay, well, we have one approval for social services.
So this is a requesting a resolution to approve the renewal of our foster care contract with Hillside from July of 21 to June of 22. The fiscal impact is it's paid per the maximum state aid rate, which is a rate that is assigned to a foster care placement, as needed with reimbursement based on eligibility. And every child that we bring into foster care, we do an eligibility. They also fill out an application for eligibility, which helps us draw down different reimbursement funding streams. So the amounts might not be the same for each child. So we couldn't give you a flat rate right there.
Okay.
But it's a contract that we do every year.
Okay, thank you. We need a motion, Mrs. Root, second by Mr. Heavy. And any discussion? Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Thank you very much, Edna.
Yep.
Anything else you'd like to add today?
I'm good. Any other questions?
I think we're
Okay.
good too. Thank you for coming. Okay. And our last speaker today is Dr. Robert Anderson, our Community Services Director, who has a budget adjustment for us to look at. Thank you for coming, Dr. Anderson.
Thank you for letting me come. I just have a budget adjustment that we are trying to do because the state aid letter amount, when I put it into the county budget, I didn't notice that I had shorted the county $18,100. No, I didn't go to Aruba or any place. The money was still there, but in order to make sure the county can use it, I need you to approve the increase of $18,100.
Okay, thank you. We'll move that from Mr. Stockton, second by Mr. Havey. Does our county treasurer have any comments about that? Nope. Okay. Okay. Any other discussion? All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Thank you, Dr. Anderson. Anything
Any
else you'd like to
questions?
add today? Any questions for Dr. Anderson?
I'm a guru in almost anything as long as.
And
Thanks very much.
And we appreciate that. Thank you, Dr. Anderson. Okay. Is there any old business today? Any new business? Anything for the good of the order? If not, we'll take a motion to adjourn. Mr. Decker?
As it appears there's no more business to come before the committee, I move we adjourn.
Thank you, Mr. Decker. Second? Mr. Havey? All those in favor?
Aye.
Aye. Okay, thank you. We are adjourned.